Hey everybody, it's Michelle Demers here. And for those of you guys who've been following my health journey as well as my time here in Ecuador, I wanted to go back in time a little bit and share my healing process with you and the amazing work of Dr. David LeClerc that I found and how he's been able to help me, and just share more about what we're going to get into today, which is Gonstead Chiropractic. Gonstead is a particular kind of chiropractic that I'm going to pass the baton over to Dr. Dave to explain more of. But for those of you who have been following me for the last couple of years, a few years ago, I couldn't walk very well. I've had lifelong back pain, other mobility issues, and I was at my breaking point a couple of years ago when I came to Dr. Dave. And luckily, I found him. I was, one night home in bed watching YouTube videos, and I found Gonstead Chiropractic. And I said, what is this? And how is it different? And I was seeing people get relief. And I was so happy to be able to find a practitioner local to me that I could go see. And Dr. Dave, I think that the work that you've done with me has literally been like the cornerstone of this next phase of my life, of my healing process. I wish I had found you earlier, and I just want everyone to know about Gonstead, but I also want them to know about you, because I have a lot of folks in Massachusetts, New Hampshire, Vermont, like within a few hours of you. And I think some people might really be able to benefit by you specifically. So, well, first of all, welcome and thank you for coming and sharing your knowledge today with us.
Thank you for having me.
So before we dive in, just because I do want people to be able to find you specifically, can you kind of give us the information of your practice that people can reach out to you?
Yeah, we're in Westford, Massachusetts. We're right on the border, kind of a sleeping community of Boston, 45 minutes away from Boston. We're about 25 minutes from the New Hampshire border, right off of 495.
Yep. And with the video, I can include phone, email, like the best way to contact
Yeah,
you
of
guys.
course. Yeah.
But what if somebody was going to contact you? What's your preferred method? To go through the
The
website or
best
email?
the best thing to do is call our office and then tell the staff, either Jessica or Gail, that Michelle Demers referred you guys in.
Oh, thanks.
Yeah,
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 I would love to know if anyone's come through me, just for the knowledge of knowing that we've been able to help people by getting the message out there.
yeah.
Um, Quickly, what's the phone number?
978-692-2900.
Awesome. And I'll include that in the text again around this video. So,
Okay.
um, Dr. Dave, I think a really good place to start is talking about the difference between Gonstead chiropractic and traditional chiropractic, because most people are familiar with traditional chiropractic. Some people love it, some people do it, some people are scared of it, they don't understand it. But then Gonstead is its own unique branch and philosophy. So can you talk a little bit about like the differences and what makes it special?
Yeah, when I started school, I just found that, in my own opinion, Gonstead was the most biomechanically sound technique that we had at the school, and it gave me I had my own success story with a Gonstead chiropractor, and I followed in the footsteps of the chiropractor that helped me out. You can ask me how like I had terrible anxiety and panic attacks,
Yeah.
and I saw everyone, and this was going on for 2.5 years. And after seeing this Gonstead chiropractor, I'm like, heck, my panic attacks are 80-90% better, and that's what made my decision to become a Gonstead chiropractor.
It's so interesting because as being one of Dr. Dave's clients, one of the things that we do when we first sign up with you is you put on a little seminar workshop for us, and
Yeah, it's for all new patients. Yeah,
you
yeah,
told that story.
yeah,
And something that a lot of people don't think about is, and I think we'll get to this in a little bit too, more, but is it's not just I have back pain, I need to see a chiropractor. You were talking about anxiety, depression, like panic, things like that. I know when I came into your office, you were explaining how, the way our spine is aligned affects our digestion system. I mean, like all body systems are affected by our spine.
Yeah. I mean, the nervous system controls everything, right?
Yeah.
When you have a better nervous system, your body's going to function better. To have a better nervous system, you have to have a healthier spine.
Right. So what
Yeah.
are the tenets of Gonstead that are like specific to Gonstead and make it a little different than traditional chiropractic? What can people expect?
The basis of Gonstead is his theory was more on the pelvis and making sure the pelvis was aligned, and then above that there was the plain disc theory, which his basis is the health of the spine is how healthy the disc is.
Mhm.
And he used many criteria. He was the first chiropractor to use full spine technique, in which the full spines on the X-ray, just not just sectionals.
Mhm.
Uh, I'll show you my scope here. He was a patient. He was using the scope on every patient visit. Okay, and this scope helps the Gonstead chiropractor decipher if the person needs to be adjusted or not, depending on how increased the nerve pressure is on the scope. Okay, and there's other
So
things we
Gonstead
help.
is a person. I don't know that people know what Gonstead means.
Yeah,
Gonstead is the name of a doctor who started this branch of chiropractic.
he graduated in 1923 of all things, and he had this he built up an immense clinic, and then later on moved into an even larger clinic in the 60s. Um, and he just had patients coming from all over the country, not just Wisconsin, and all over the world to see him. He actually had his own hotel in which his patients would sleep over for weeks on end to get better and healthier. And I believe, I could be wrong, but I think Mayo Clinic used to refer patients to him all
Oh,
the time.
okay.
Yeah,
Yeah.
yeah,
So yeah, what I loved about it was at the difference that I felt in coming was when I came to see you, we did x-rays, like you
yeah,
said, full body,
yeah,
side, front and back. Um, then the nervoscope, so that device you were just showing,
yeah,
that that runs up and down the spine, and that
yeah.
tells you what? What does that give information is that giving you?
It tells us exactly where the problem is, where that joint's causing nerve interference or nerve irritation. Um, and it tells us they could be like an acute issue or a chronic issue.
Right. The scope
Okay.
is actually measuring heat, right? Which is
Yep.
inflammation.
Yep. Yep.
Okay.
Yep.
Right. And so I felt like as a patient, I was getting a much more comprehensive view of my issues from a full body perspective. I liked being able to not just know that you were seeing the inside of my body, but like we could look at it together and you could point and say, here's where there's an issue, here's where there's an issue. And then you could use the scope to also find things that sometimes may or may not show up on x-ray, but it's showing at a deeper level where there might be, and the correct term, and correct me if I'm wrong, is a subluxation. Is that right?
Yes. Yeah. Yeah. And I
Right.
find that the more, like what Dr. Gonstead said, is like the more tools, the better, you know? So you get
Mm-hmm.
the X-ray, which is the map, you get the nervoscope or this delta T scope, which is like your compass.
Mm-hmm.
And the patient, the other thing is our patients either our female patients are typically gowned, and the
Mm-hmm.
males will have their shirt off, or if they're uncomfortable, they'll be gowned. And we're looking at the skin at all times. You know, if there's inflammation in the skin, edema, we're seeing that as Gonstead practitioners. It's just not, we're not adjusting through your clothing or palpating through your clothing.
Yes, yep. And I always felt safe and secure
Yeah, yeah,
with that process. And yeah, I think it makes a difference because you're seeing the skin. And so you're also looking for inflammation that's showing up in the form of what you said, edema, like
yeah,
swelling. When you're touching, you can see where fluid is pooling under the skin. Is that right?
yeah. And if you touch the spinous, I'll show you. Sometimes when you touch the spinous on the back right here, and you'll touch it, it'll go beet red. just by putting your finger, and that's when you know there's a problem there also. Okay.
The other thing I liked as a patient um, is that we came up with a game plan.
Yeah.
You were able to say, Michelle, here's where you are, here's your issues. And I had typical issues. A lot of folks with, you call it tech neck, right? These days with the looking down, like we lose the curve in our neck, but also
Yeah.
because in my history, I've had a spinal fusion in my lower back from L4 to S1. I'm fused. So that created other issues going on down there. And when my mobility issues really started a few years ago, I was thinking I was going to have to go back into the operating room because that's the world I came from. Something hurts, we got to go have surgery to fix it. I wasn't even thinking that I could feel better without a surgical intervention, especially with the issues that I already had. So what I loved was coming in, and it was a 2-session diagnostic visit. The first visit was you did all the diagnostics on me. The second was we reviewed everything and came up with
Right.
a plan,
Right.
which I loved. And my plan was 3 months long. The first month we were doing 3 times a week for adjusting. Then we moved to 2 times a week. And I think after 3 months, we went down to once a week.
Correct.
But
Yep.
the goal was to reestablish the healthy curves in my back because the pain, the mobility, I was having sciatica, other things was being caused by the fact that the curves were not in their ideal formation, right?
Right. You actually had too much of a curve down low.
Yeah, yeah,
Yeah.
yeah, too much, too much of a
Of all
good
things. Usually we
thing.
see too little, but yours was too much. Yeah. Yeah.
Yeah, yeah. So, getting back to Gonstead though, like the philosophy, the you know the difference of other chiropractic, another difference that I felt as a patient was because we had a game plan, and it was here's where your spine is, here's where we want to get it, here's what we need to do to get you from A to B to C. It had such a different feeling than, ooh, my back's hurt, it's out. I Let me go see the chiropractor for a quick adjustment. I go in, crack, 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 leave. I never had a sense of like what the goal was we were trying to achieve, or what it was going to take to get there, or that it was going to be a process, or all the education that you did along the way was so valuable, and I think is what has helped me continue to heal. So can you talk about that sort of thing?
Yeah. I mean, every patient's different when they come in the office.
Yeah.
And we usually give you like a grade of where your spine's at. We call it like a phase 1 or phase 2 or phase 3. Can I talk about your case a little bit? Is
Oh,
that okay?
absolutely.
Yeah.
Open
And I
open
believe
book
you were,
here.
you were a phase 2 degeneration. Uh, Actually, your bones were not, even after the surgery, their bones were still anterior, or they were slipped, probably causing immense amount of pain. So I told you in the beginning we were going to focus mainly on your pelvis, which we did.
Mhm. Mhm.
Just giving you a little bit of a tilt to take the pressure off. And after that first month, you were getting, 30% relief maybe,
Mhm.
and then we tapered down, and then you were, holding your adjustments a lot better. And I think after 3 months, you were 80% pain free. And then we put you on what's called maintenance or wellness care, which is reduced. And here you are, smiling and happy.
Yeah, the first day I came in to see you, I was taking an average of 15 Advil a day.
Yeah.
That's where I was. I was using walking poles to just
Yeah. The
walk
two walking poles. I remember that. Yeah.
around,
Yeah.
just even normal daily life walking.
Yeah.
Um, I had to hold on to the furniture in my house to get from room to room. I could barely
Yeah.
stand to cook meals or anything like that. I mean, quality of life was almost nothing. And I remember in that first month, and one of the things that you're great at was just like helping your patients like stay focused on the end result. Because even in
Hmm.
the first month, as we were starting to fix things, I was still in a lot of pain.
Oh yeah. Yeah.
I was still saying, hey, do I need a cortisone shot? Or like, hey, can I stretch this or that? And you're like, whoa, hold. Like,
Yeah,
we got to do this first. We got to do that first. And I
yeah.
have to say, I was a good patient. I listened. I didn't do anything you told me
You're a
not
great
to
patient.
do. But yeah, like that was big. Like one of the things that I learned from you, and I think this is important for anybody listening, is a lot of the things I was doing to try to alleviate my own pain was actually making it worse. And I did not know that.
Mhm.
So one of the things I was doing a lot of was reclining with my legs up.
Yeah,
And it felt great while I was reclined. But as soon as I tried to stand up to walk, I was like hunched over because my body was used to being in more of like a V like position, like back raised, legs raised. That makes a V if you think about it when you look at it
hmm,
from the side.
yep,
And then you try to stand, well, your body wants to be forward because it's
yep,
used to being in that position. So I was shortening the muscles in the front of my body and I was lengthening muscles in the back of my body and I was off balance. And that vicious cycle was as soon as I would stand up and I'd be hunched over and I'd be in pain, I'd be like, oh, I got to sit back down and put my legs back up. No, that was what was causing that. So
yeah.
you actually helped me to sleep flatter, to be more aware of my posture in all of my daily life. We talked about, not looking down at the phone when I'm looking straight, how to adjust my computer, and like all sorts of different things like that.
Oh yeah. I mean, our problems now are problems of the 21st century. From phone. I mean, our kids now are on their phones since they've been 10 years old, looking down. You know,
Yeah.
we sit for a living. We sit when we drive. I mean, that's the epidemic right now. You know.
Yeah. Absolutely. And also, the other thing I was doing a lot of was heating pads and hot baths.
Yes, yes. And I
And
was
you were,
telling you to ice, ice, ice.
I know, I'm like, oh no, like
Yeah.
that was
Are you
making me feel
sure?
good,
Are
but it
you
was
sure, Dr. Dave?
I know, I know. There were times I wasn't quite, like, Dr. Dave, come on. No, no.
Yeah,
I mean, it was so valuable what I was learning because I was doing the opposite of what was actually going to help me heal.
right. And we all do
Yeah.
typically.
Because we don't know
Yeah,
any better. Even
right.
like where in your workshop, you're talking about how our car seats are so that our legs are a certain way when we drive. I mean,
Yeah, like if you drive a sedan, typically the seat is tipped, so your knees are above your hips, and that puts
yeah,
more pressure in your lower back. Compared if you drove a truck or an SUV, you can tilt the
right,
seat down, and that relieves some of the pressure in the lower back.
exactly. Well, fast forward, you know, I started seeing you. Well, okay, let me back up.
I think you started seeing me during the pandemic too, during
Dave
COVID,
never
right?
saw Dr. Dave never
No, I
saw
never
my
saw your
face
face.
because I was masked the whole time. I was terrified of getting COVID because just coughing, like not even the am I going to die from COVID, but just the coughs that people would get were so painful on my back. I just didn't
Yeah,
want to
yeah,
get sick. So yeah, I was always masked. So yeah, hi Dr. Davis. Like first time you seeing my face.
pretty much.
But yeah, no, I came in, it was August of 2021, I
Yep,
believe.
yep,
Really worked intensively with you from August 2021 through about April, May of 2022.
yep,
And so now we're a year from then.
yep,
And I'm no longer take Advil every day, nothing.
yep.
I've lost 12 pounds, which I still have a ways to go on the weight, but that has reduced some inflammation. I've learned how to eat better. Another thing is Dr. Dave is in practice with his wife, Dr. Carla,
Yep.
and you also do nutritional education. You help with the diet from an anti-inflammatory standpoint. You have some other supportive services as well that tie into
Yeah,
what you do.
yeah. And I mean, when you did the every 12 to 10 to 12 visit during your plan, you would have a progress exam, but you wouldn't meet with me. You would meet with another doctor, and that was Dr. Carla. You're getting another eye on the case too, you know?
Yeah. Yeah. And one thing I'll do, I'll try, hopefully I can do it, is I'm going to show the printouts of the progression
Yeah,
of the nerves that we
yeah.
what was that called?
That's
The
that was a thermal scan, okay? And it shows what we're seeing with the scope and the
yeah,
progression. I mean, when it was red, that means it's really inflamed and not working properly. And then we got to a level, I think everything was green. That's when your nervous
yeah.
system's working better.
Can you talk a little bit about chiropractic as maintenance as opposed to I'm already in pain and I got to fix a problem, but more of just care of the spine, just like we go get our teeth cleaned, taking care of our spine should be something we take care of before it
Yeah,
gets
I mean, we
to a
take better.
place.
I mean, if our spines were on our face, we take a lot better care of it, right? Literally. So the lifestyles that we live, like I was explaining before, I was always telling you sitting's the new smoking, right? And that what it does to your spine. So it's so important to do what we call maintenance care, just like how we brush our teeth every day, maintain the health of our spine for a lifetime. Because I mean, that spine, a healthy spine equals a healthy nervous system equals a smiling face like you. You took care of your spine. That's the result. You have to do it preventatively.
Right.
Yeah.
What's your advice for people who don't have a Gonstead trained chiropractor near them? And by the way, they can go to gonstead.com. That's
Yes, they can.
GONSTEAD.com. And you can
Yep.
look for a practitioner.
Yes, you can.
And I will also tell people also Google practitioners because not every practitioner is listed on that website. I found somebody here in Cuenca. I have not actually gone to them yet, but I want to continue the good work that I did with Dr. Dave in a maintenance style. And there is actually a Gonstead practitioner here in Cuenca, Ecuador.
Awesome.
That I would like to go see, but he's not listed on the Gonstead site, so they
Well, I
can
mean,
just
what we can a
well.
great way is like not everyone's listed on the Gonstead website, but what you can do is if people are interested, they can tell you where they live, and then you can contact me, and I'll find a good Gonstead chiropractor.
Oh, okay. Thank you
Okay,
for
no
offering that
worries. Yeah,
because yeah, that's hard for people. How just out of curiosity, like the patients that travel the furthest for you, how far away are people coming in for you?
the furthest I would say, I have a patient that lives down on the Cape. Okay, so I have people from Maine, New Hampshire, Rhode Island, but the Cape is the longest because they hit the worst
Yeah.
traffic. So she drives 2 hours, so 4 hours a day to see me.
Wow.
So
Wow.
2 hours to see me, 2 hours back.
And it's worth it because
Yeah,
this is like changing your life. Like if you and it doesn't have to be forever, but if you can do the work and be consistent and get where you need to go, that putting that investment of time and effort in is really worth it. Like that's why I'm here walking around today in Ecuador because we
it's
did the
awesome.
work together.
We did do
So
the work,
yes,
and
but
I
I'm
just
so
didn't do the work. You did the work too.
thank you. The one last thing I do want to say is, I learned of Gonstead because I was watching YouTube videos and stuff. And I think, at first I'm thinking, oh my gosh, I got to go see the guy in the video, right? But he
Right,
wasn't local.
right.
And I just want to tell you, it's so important the continuity of care, of being able to go to a practitioner that works into your daily life and lifestyle for the long term is so important. So,
Mm,
um, don't overlook the people that are the practitioners that are local to you. Go see them
exactly.
because
There's tons of us. There's tons of us. Yeah.
absolutely.
Yeah.
But I do have to say, Gonstead has changed my life. And I actually would even encourage anyone. I mean, tell me if you agree with this. I almost think like it doesn't matter what issue you're having, digestion issues, headaches, tinnitus. I have a friend with that. Traditional arthritis, orthopedic issues. Like I almost think that the spine is where it all starts. So just going and seeing a Gonstead chiropractor is part of hey, I want to get everything checked out and I want to dot the I's and cross the T's. I mean, would you agree with that?
That's our premise right there. We always look to the spine. Yeah,
Yeah. And
totally.
I would encourage people to see a Gonstead chiropractor before going in to see a surgeon or operation. Like really consult. Sometimes surgery might be necessary, but sometimes it isn't, and it's good to know your options.
Great
Yeah.
advice.
Yeah. Any last words, Dr. Dave?
No, I'm just so happy you're doing better. That makes my life awesome. Just to see the results we have in our office, that makes my day every day. I don't work, I play at work. It's fun. Yeah.
Well, the smile is definitely, in large part to you and Dr. Carla. And I have to give a shout out to the office staff because
Aren't they great?
you're like the ladies at the desk. I mean, like they make you feel so loved, like family, and going in every day was such a pleasure. And I just felt like I felt cared for, not just like a patient, but I felt like family.
We all are.
So
Every
thank
patient
you.
is my family. Yeah. Yeah. No worries.
Thank you for your time, Dr. Dave. Thanks for sharing your work in the world, and thanks for doing what you do.
All right. Thank you.
Take
Bye.
care.
Yeah.